Today we have Margaret Thompson, a 27-year-old African American female. She presents with a chief complaint of recent unprotected sexual intercourse with her husband because she ran out of oral contraceptive pill. Her history of present illness includes generalized motor seizures controlled on topiramate recently, but she discontinued medications following unprotected sex with her husband, and she's looking for medication restarts and or changes. Her past medical history includes childhood asthma, but she's had no treatment or symptoms for the past 8 years. Also, generalized motor seizures. She's been stable for about 2 months on the topiramate. Her first seizure was in 1996 when she was about 5.5 years old. Her family history: her mother's alive and her father's deceased. Her mother did have an MI at 58 years old. Her social history is that she quit smoking 3 years ago and denies recent alcohol use. She has a medication allergy of gabapentin. She has edema when she takes gabapentin. She recently discontinued all medications she was taking, but prior to that, she was taking topiramate, 100 milligrams twice daily, and the oral contraceptive she was taking was Trisprintec, 28-day, a 28-day pack, 1 tablet by mouth daily. Her immunizations are up to date. Her physical findings: she had lethargy but no acute distress, intermittent insomnia, breast tenderness with guarding, and nausea. She had unremarkable cardiovascular, respiratory, urinary, and neurologic systems. Her vitals blood pressure were 110/72. Her heart rate was 90. Her temperature was 98.2 Fahrenheit. Her respiratory rate was 14. Her height is 69 inches. Her weight is 158 pounds, and her BMI is 23.3. For labs, she was HIV, chlamydia, and gonorrhea negative. She was positive for HCG urine. All of the BMP, CBC with differential, metabolic panel values are normal, except her red blood cells are slightly high at 5.1 milliliters. Her serum creatinine was 0.8 milligrams per deciliter, which made her creatinine clearance 120 mils per minute. So her problem stated is an unplanned pregnancy with generalized motor seizures as a history. Patient discontinued oral contraceptive, has a positive urine HCG, tender breasts, nausea, and the recent unprotected sex with a husband. And then again, the history of the generalized motor seizures diagnosed around age 5 that have been stable for approximately 2 months on the topiramate. Current neurologic exam was unremarkable, and patient discontinued epilepsy medicine recently due to that unprotected sex. So our goals are to refer her to an OBGYN for her prenatal care, control her seizures while pregnant and after pregnancy, improve her quality of life. Her drug regimen: so we want to discontinue the topiramate 100 twice daily. We also want to discontinue the Trisprintec daily. We want to initiate folic acid 5 milligrams by mouth daily. She wants to take that while she's pregnant and continue after pregnancy. We also want to initiate lamotrigine 25 milligrams daily for 2 weeks. Then we're going to increase to 50 milligrams daily for 2 more weeks. And the dose will continue to increase by about 50 milligrams a day until we reach a maintenance. And many maintenances are between 225 and 375 milligrams daily in 2 divided doses. So again, for initiation, we're going to do the folic acid 5 milligrams daily and lamotrigine 25 milligrams daily for 2 weeks, and then increase from there. For the lamotrigine, we want to monitor serum level of the anticonvulsant because changes during pregnancy can affect anticonvulsant levels. And also we want to monitor for skin rashes. It's a black box warning for lamotrigine. The folic acid, we want to counsel that we want to continue this again during pregnancy and afterwards. And the lamotrigine, we want to ultimately use the lowest possible effective dose. So per the NICE Epilepsy Diagnosis and Management in Adults and Children in Primary and Secondary Care Guidelines, valproate and lamotrigine, or topiramate should be first line in generalized seizures. Topiramate can cause fetal harm if given while pregnant, and valproate has a black box warning for major congenital malformations. So valproate and topiramate are contraindicated in pregnancy, so we would recommend her start lamotrigine. Also, per the NICE guidelines, folic acid doses of at least 5 milligrams daily are recommended. This is higher than the normal milligram because she is a high risk. If you have any questions, please let me know. Thank you.